For the people of Indore in India, the year has started on a tragic note, to say the least. Indore, which has been repeatedly projected as India's cleanest city for 8 consecutive years, is grappling with a horrible tragedy, a case of major civic apathy, it seems, as more than 2,000 residents have fallen ill after consuming contaminated drinking water. The drinking water supplied through the municipal pipeline in the area resulted in the deaths of at least 4 people. This is not a natural disaster. This is not an act of fate. This is a man-made crisis, born out of negligence, apathy, also systemic failure, as many have alleged. The contamination point was identified near a police checkpoint where a newly constructed toilet was dumping its waste into a sinkhole instead of a proper septic tank. The sinkhole was exactly above the water supply line, which had a joint. And over the past week, hospitals in the area have been flooded with patients suffering from vomiting, diarrhea. More than 100 residents had to be admitted. Over 160 people remain under treatment, including several in intensive care. The Madhya Pradesh government is yet to officially declare the final death toll, but where was the system when people first started falling sick? Only after public outrage erupted did the authorities act in this way.
I am also confused about the actual death toll at present. As per government data, 4 people have died, but when I visited the hospital and the affected area, I learned that 8 deaths have occurred. We will look into how the government released the data. Some deaths could have been due to natural causes. The line of treatment will make things clear.
You just heard what the Madhya Pradesh minister had to say. Appears confused about the death toll, and when confronted by a reporter, instead of taking responsibility, he chose to snap at the journalist. And naturally, this clip quickly went viral, triggering massive public outrage and a string of serious questions. And only after this outrage did the minister issue an apology. But then an apology cannot do much. Is it not only this lawmaker, in fact, who is confused about the number of dead? Because even now, the top medical officials of the Madhya Pradesh government do not seem to have a clear answer to that. Take a look.
8 deaths have been reported. 4 were officially declared as diarrhea-related. The remaining 4 were residents of the affected area, so we can consider that they died from diarrhea-related diseases because their families are saying this and they belong to that affected area. We can consider this, but we cannot confirm.
You see, in a public health crisis of this magnitude, confusion is not just incompetence, it's a failure of governance, to say the least. 3 officials of the Indore Municipal Corporation have been punished, 1 dismissed, 2 suspended. Officials who were responsible for monitoring the water supply, officials who failed to detect leakages that allowed sewage from a toilet to mix up with drinking water that people were consuming. Let that sink in. In a city branded as a national model of cleanliness, sewage entered the main water supply line and into people's glasses. No one noticed. Worse, no one acted. Senior ministers and the chief minister have visited hospitals now. But residents are asking, where was this concern and urgency when the first complaints trickled in? Could timely intervention have saved lives? The Chief Minister has termed the incident extremely tragic and announced financial assistance of 2 lakh rupees each for the families of the deceased, free treatment for the affected. A 3-member committee has been formed now to probe the incident. But here's the uncomfortable truth. A tender for a new water supply line had been issued months ago. The work never started. Who delayed it and who benefited from that delay? And will this committee answer those basic questions, or will it merely produce another report that only gathers dust? The Madhya Pradesh High Court has now stepped in, directing free treatment for all patients after reports that private hospitals were demanding money before admitting the sick. And that directive itself raises another disturbing question. In a situation like this, in a public health crisis, why were patients asked to pay at all? Protests are mounting, so is the anger. Clean streets mean nothing if the water that people are drinking is contaminated. Branding cannot mask broken infrastructure or the anger on the ground. Silence cannot wash away responsibility. So tonight on Gravitas, we are asking the questions that remain unanswered. Who allowed the contaminated water to actually flow unchecked in this manner? Why were early warnings ignored? Why was critical infrastructure work delayed? And will accountability stop at junior officials, or will it actually reach those who truly run the system? As Indore mourns, we must remember this development without accountability is a lie, and cleanliness without safety is just a headline. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.